please state your name and the experience that you had in the physical therapy and massage therapy field?
My name is Meg Gilman, and I have a undergraduate degree in sports medicine. I have a master's in exercise science. I have worked in physical therapy clinics for probably 6 to 7 years. I am in a former life an EMT, emergency medical technician. I'm also a massage therapist, and I've specialized in neuromuscular and trigger point work, including myofascial work. I'm also an athletic trainer, and I have been for over 10 years now. I am licensed in the state of Massachusetts, and I've been licensed in a couple of other states. And now I am keeping busy taking care of about 12 sports at Dean, including 200 dancers.
What are some of the injuries that you've seen that are most common that dancers come in with?
Well, jokingly I say almost every injury is common, but the ones that are, I would say, the most prevalent and also perhaps most detrimental are knee, hip, and feet. There seems to be this division between upper and lower body. You use your upper body quite a lot, but it doesn't seem to take the same abuse. The lower body is truly where the impact from all of the different dances makes its impact. One, a lot of it is the feet, because as you know, a lot of you do not wear shoes or footwear during dancing. During the rest of the time, you also wear atrocious footwear, including flip-flops and Uggs. Terrible! Also from high impacting, you get a lot of knee injuries. Many of you do not stretch on a regular basis, which is unbelievably detrimental, and because of that, it affects the other body, limiting range of motion, limiting your ability to accelerate force, and because of that, a lot of you start compensating, which then causes problems in other part of the body. This year, because of also an excess of people in points, I've been seeing a lot more peroneus longus and post-tib issues in the lower leg. And every so often we also get the occasional ankle injury. Yeah.
What do you think the biggest difference is between dealing with dancers and dealing with athletes in the training room?
Well, I just like to state for the record that I call you dance athletes. We have a division. We call everyone else sport athletes, and we call you all dance athletes. And why we do that is because you are athletes. We actually have a sign-in sheet, and we keep track of numbers, and you all come in more than football, even during the fall. You are constantly moving. It's not you're here to take classes and then for 2 hours you're out on the field working hard. Your time here and your classes are spent actively moving. Not only that, but my fear and my concern is that not only you taking an hour, 2 hours to 4 hours of dance classes a day, in addition, you are rehearsing 4 to potentially 5 more hours on top of that a day, 6 to 7 days a week. When you are exhausted from lack of sleep and dancing that much, latest studies have actually shown that after 4 or 5 hours, more physical use is actually detrimental to the body because you have used up reserves and you have used up the body's energy to properly function and regulate itself. That's the problem. So you dance for twice as long as the recommended time. That's the danger. You can't just go out there for 2 hours and come back in and stop. You dance all day, almost every day. And that is the difference, and that is the danger.
As far as advice goes for dancers, what are a few things that you feel are extremely important for them to do in order to maintain their health during the season?
Well, there are a couple of trends that I've really been trying to hit hard, especially in my kinesiology class. One of them is overall cross-training and conditioning. Many of you come in with one leg you've been leading with for years. One leg is weak, one leg is really tight and stronger. You have to be even. You have to be able to have control over everything. And by cross-training, not only do you make sure that your right and your left are even, but your front and your back are even, your sides are even, everything, you are in control of all. And that is important, because when you start to lose control of things, that's when there's a danger. When you have a strong core, your stomach, your sides, and your back, you have greater control over your body and a less propensity for injury, which is key. Also, you all have some of the worst nutrition and sleep habits. You don't understand that sleep is not only necessary, but unbelievably necessary for function. If you want to dance, you have to sleep. If you want to stay alive, and you have to sleep. If you want to perform, you need to take care of yourself. Sleep, eating well. My concern is, again, in this sort of a culture, you have people who are very concerned about how they look, but you can safely is the key, control how things are. People don't understand that you're burning so many calories, again, more than the football players, that if you don't eat enough, you will gain weight. If you don't eat healthy enough, you put yourself at risk for illness and sickness and injury. That's my concern. So sleep, overall strength and stretching, nutrition, the basics, a strong core, are the things that I want to drill into every single dancer until they get sick of me, and then I'm going to keep doing it.
And lastly, there are many different types of therapies and ways to help a body heal. Why is massage therapy significant for dancers?
I believe that massage therapy is fantastic for everyone. Especially dancers. One, massage therapy is fantastic for athletes in general, but because you all use your bodies as your livelihood, to get through schooling, your body has a habit of sometimes rebelling, and it tells you when it's had enough, and sometimes you try to push past that despite it telling you when to stop. And because of that, it needs some serious TLC and upkeep and maintenance. It's just like a machine. Your bodies are machines, and it needs constant working on. And a great way to make sure that both sides are even. Your legs, your right is not tighter than your left. You will get the range of motion in your hamstrings on both sides. Your quads, one of them is not tighter than the other. Hands-on is just so fantastic. It makes you aware of your body, which is something that many people don't understand. You will actually be able to understand what's tight, because sometimes not only are we in denial, but we're just not aware of these things. We're blissfully ignorant of ourselves. And by doing massage and having someone work on you, you actually get to experience through their hands and how much pressure they're using and technique, what areas you need to work on, which is just absolutely, so it's almost like a hands-on education, but in the same point, it's also a healing mechanism. Because if you were getting over a quad, a hamstring, a muscle injury, that will help facilitate. If you are having trouble getting range of motion because you're tight, that will help you. Muscle has memory, and sometimes you need a little bit of help convincing it needs to do one thing instead of another. And not only that, but it also just helps us to calm down mentally and physically, and helps us remind ourselves of a human body-mind connection. And I think because of that, especially in the medical field, we have forgotten about that. Doctors many times refuse to touch their patients. And I think that if we did that more and understood what our bodies were telling us and what was tight and what we needed to address, I think we would all be better off for it. I think we have lost a human connection, and that's one way that we can get it back. And that's why I think it's so important for dancers to know their bodies through another person who can help show them. And that's why it's so great.
Well, thank you very much for your time. I appreciate it.
Not a problem. Good luck.
Now this is very